Hello. Happy, what day is it today?
Today is Wednesday.
Wednesday! We jumped on a little early, but it is cold here. I don't know about you guys. It is freezing cold. What is it below here today?
I think it's like -20. It feels like -50.
So with wind chill, it's -50 here. So crazy. Thank you guys for spending your Wednesdays at 6 p.m. Eastern Standard Time with us. Again, for those that don't know who we are, my name is Dr. Madiha Saeed. There we go. My name is Dr. Madiha Saeed. I am a board-certified integrative holistic family physician. And I am here accompanied with my son,
Abdullah.
He's getting the hang of it. Abdullah. And we are here today because we've been really talking about the factors of inflammation. And so no matter what you're dealing with, whatever chronic condition you're dealing with, if you're dealing with digestive issues, headaches, autism, problems with your skin, eczema, psoriasis, acne, problems with your hair like alopecia, problems with your thyroid like thyroid disease, that like Hashimoto's or Graves' disease. If you're dealing with digestive complaints, I said that, and then I think sinus issues, allergies, joint pain, fatigue, just not feeling good. You know what? All due to
Magnesium deficiency.
Magnesium deficiency, but also inflammation, right? And so because we're going to talk about the factors, we have been talking about the factors of inflammation. And for those that haven't, let's catch up, right? Let's catch up. And that is when you have vitamin D, when you have all these chronic conditions, deficits in any of these can lead to your chronic conditions. How? Because of the fact that it leads to inflammation. Thank you guys for sharing. Thank you for the heart love. I would love to know where you guys are from, how you're feeling, what kind of questions. We're here today on a cold Wednesday morning that they're off at school. And
Afternoon.
Sorry, afternoon. So please let us know. We're here for you. Please give us your heart love. I want to know where you're calling from. I want to know how cold is it over there, or how warm is it? What is the temperature over there, right? Tell me what you guys cooked today. I want to know all of it, right? Because we can tell you what we cooked today. We cooked a lot today.
Yeah,
we cooked a lot today. Because when we're home, we like to cook together. Yeah. Oh, Ashifa is from London. Woo! Hi, Ashifa. Thank you for joining us. Okay, so now that we got people jump on, I'm going to quickly do another recap. I am Dr. Madiha Saeed. I am a board-certified integrative holistic family physician. So that means I'm a board-certified MD, doctor. Right after residency, I joined this medical practice where under one roof there's me, an OBGYN, an internist, an exercise physiologist, nutritionist, counseling, chiropractor, massage therapy, and all brought together for the complete healing of the whole person. And that was really weird for me because the fact that I myself dealt with digestive complaints, I have problems with the thyroid, I was on Synthroid for 8 years of my life, I had severe constipation, I had severe hormonal imbalances, acne, seborrheic dermatitis, eczema, I was tired, I was sick and tired of being sick and tired, and then I developed lupus. And then when the doctor told me, sorry, you're just going to have to let this live its course, a disease that can kill you, I'm not going to just sit around and let a disease just kill me. So I'm going to at least try my hardest to do what I can do. And then the rest we're going to leave in the universe's hands, right? But there's so much that you can do. Because once I discovered that all of these symptoms, because when you go to your regular medical doctor, they have 15 to 20 minutes with you max. And in that time, they really don't have enough time to really get to the underlying root cause of your symptoms. So if you're dealing with, I want to know what you guys are dealing with. What are your symptoms? Because no matter what your symptoms are, either if they're depression, anxiety, sleeping problems, fatigue, problems with digestion, constipation, diarrhea, indigestion, sinus issues, allergies, pain, so all of these, autoimmunity, cancer even, all of these, we doctors know that the underlying root cause is due to inflammation. And that inflammation literally means fire inside. So what's really, really cool is that where all of these are your separate symptoms, so doctors may give you a treatment for each one of these symptoms, but no one is looking at the underlying root cause of why you're dealing with these symptoms. So what's really cool is because of the fact that if you can deal with the underlying root cause, you can heal not one symptom, but then all of them simultaneously. Isn't that awesome? But what are those can you go through the thing?
So the defense, so if you have,
the board. Can we talk about all the deficits? Because we have a lot of people that don't know what we're talking about. So deficits in any of these can lead to inflammation that can cause your chronic symptoms. So if we can put all of these pieces back into balance, you can heal not one symptom, but then all of them simultaneously. And what are those symptoms, Abdullah? What are those parts?
So the parts are detoxification, healthy food. You have to eat the right foods. You have to have a healthy gut. Then there's stress, sleep, social health. You don't want people to drag you down. You want people to pull you up. And then gratitude.
So we got to make sure that all of these pieces are balanced. I know it seems so simple, but it's really, really powerful. Okay, so just because this is your baseline, then everything that you do goes from here on up. So lifestyle is key, right? And let's take a break and see where everybody is from. Thank you guys for sharing. Go ahead, please like and share so whoever is really suffering, I can sit there and answer some questions for them. We have is from Northern Indiana, Marcy, yay. We have Fatima from London. Zainab is from Cleveland, Ohio. It feels like 30. Oh, wow, yeah. Alia is from New Jersey, Alia says, I just came home from an excellent doctor's appointment with a new doctor, and she said the same things you were mentioning now. We talked about inflammation, and he wants me to go on an elimination diet for 21 days, and he gave me a supplement to heal my gut. Good job, Alia. That's awesome. So make sure, because we're going to talk about the pieces, right? So all of these, we do an elimination diet in our house. It's no grains, no dairy, no sugar, no processed foods. I sort of live that lifestyle because I feel like the kids eat more vegetables that way, and we don't do any grains or dairy or sugar on a regular basis. I leave those as treats. But it's really, diet is key. But sometimes even with diet, it's best to even take some supplements because the fact that we're not just getting enough, and it will really help to expedite your healing. So we talked about vitamin D last week. The week before that, we talked about supplements, so you guys can go back and check that out. Then we talked about vitamin D. Today, we're going to be talking about magnesium, because magnesium is an essential mineral. And what is it used for? It's for like nerve cells, muscles, bones. It takes major role in immunity. But but then this is where it's really scary. Abdullah, did you know that 70 to 80% of the population was deficient in magnesium?
No.
That's crazy, right? That 70 to 80% of the population is deficient in magnesium. 70 to 80% is deficient in magnesium. And your cells need magnesium to work. Did you know that?
Yes.
So your cells need magnesium to work. Why? Because of the fact that that includes like all of these enzymes and hundreds, like 300 enzymes that you need magnesium to work. Then on top of that, hundreds of body processes, for example, that use to synthesize ATP, DNA, RNA, cofactors of methylation and detoxification. And then they're also vital for, muscular contractions and production of testosterone and progesterone, utilization of fat, and then protein, carbohydrates, metabolism of calcium, sodium, and potassium. And they're like the teeth right? And bones. Magnesium can actually reduce like spasticity of the muscles, improve chronic pain, digestion, mood. I'm going to talk a little bit about that. It helps you with sleep. But even deficiencies are linked to heart disease. So if somebody is feeling deficient, right? So if somebody is deficient, so the deficiency can cause a lot of symptoms, right?
Yeah.
And some of the most prominent symptoms, so those going to tell us what the symptoms are if you have magnesium deficiency.
Well, some of the symptoms can be hypertension, cardiovascular disease, kidney and liver damage, migraine headaches, nutrition deficiencies, trouble sleeping, spasm, mood swings, a depressed immune system, cavities, muscle weakness, and cramps and
so that's what you have, right? When you feel like, what do you feel when you need a magnesium? Because you take magnesium regularly.
Yeah.
Tell me what you feel and how does it help you? And how does it help you?
It helps me run better.
It helps you run better? Why?
Because otherwise, I don't know how to say it.
You get cramps.
Yeah.
Because he gets cramps sometimes. So therefore, that's where he knows that he's magnesium deficient and he'll come on and get that. Because again, just to recap, you start to feel fatigue. It's one of the main, if you're fatigued, always make sure that you have magnesium. Like these are the 4 supplements that I recommend 90% of my patients. And that is fish oil, magnesium, probiotics, and vitamin D. We talked about vitamin D last week, and now we're going to talk about magnesium. Because again, 70 to 85% of people are deficient. Now that's crazy. And what are those symptoms of your deficiency? And that is fatigued, if you're anxious, if you're experiencing chronic pain or cramps, difficulty sleeping, problems with numbness or tingling, if your heart is racing or if you have abnormal rhythms, heart rhythms, if you have carbohydrate cravings, right? And or even losing appetite, and then blood sugar regulation that leads to chronic illness. Thank you guys for the heart love. Thank you. So, and again, we're here for you. If you have any questions, please feel free. Abdullah, if you want to ask anything from Abdullah, he lives this type of lifestyle. So, and if an 11-year-old can do it, you guys can do it. So we talked about the need for magnesium, right? And there's lots of different ways that we can get magnesium. So there's supplementation, and then there is from food. So for supplementation, we'll talk about the food aspects, but for supplementation, there's many types, and that is where things get a little tricky. So there is, Abdullah, do you know any names of the magnesium?
Well, some names are magnesium, chelate, chelate, chirate, citrate, glycinate.
Yeah, that's the one we take. We like to take glycinate. And then there's citrate. So citrate is really good for those people who have constipation issues because it really starts to get things moving and preventing constipation. I know my family likes to take that one. We like to take a combination of all those, but because glycinate is really highly absorbable and is recommended for anybody with a known magnesium deficiency or is likely, I also and it has less of a laxative type of effect. So then there's threonate and ornate and all of these different types of magnesium oil, even for people who can't even tolerate it digestion wise. Because especially if they have lots of digestive disorders, that you could easily apply to your skin. That works with a lot of my patients also. But what's really cool, yes, do I have a dose? So what I like to do, thank you, Marcy, for magnesium, remember that's the supplement that I recommend most of my patients on. I recommend people take at least 400 milligrams of elemental magnesium by mouth every day to fix a deficiency. In my clinic, I have patients get their magnesium levels checked. And when we check their magnesium levels, if it's 2.1 and less, because I do a serum magnesium level, and if it's 2.1 or less, most likely they have a deficiency, especially if it's less than 2, definite deficiency. And so just by optimizing, and when you get your levels checked, I have my patients go on about 1,000 milligrams per day for about 3 weeks and then go down to 500 because then they're already deficient. But all of us are mostly deficient in magnesium. I haven't met anybody that isn't, unless they're eating lots of vegetables, because of the fact that there's a lot of people. Yes, you can take magnesium while breastfeeding. You can also take it while you're pregnant. It actually helps to prevent preeclampsia because it helps in hypertension. So it's really important. So we talked about the different types, how we have magnesium glycinate, chelate, malate, those are the ones that are the best absorbed. Again, you want to avoid magnesium supplementation if you have like poor kidney function, or if you're constipated, I would not do magnesium oxide. So we want to take, and then what's really important for supplementation wise is you take magnesium and calcium at least 2 hours apart from your multivitamin, because of the fact that it causes problems. So that was that piece of it. Now we wanted to talk about where you can get it from because we talked about the importance of it. And unfortunately, you get it in all of these. I want to just let you guys know that the reason why people are, look, Alyssa's here again. Hi, Alyssa. The reason why people are so deficient is because of the fact that when our diets have a lot of deficiencies in them, we have because of the fact that, especially if you're if you're just eating on like a keto type of diet, we're not getting enough of that, especially if you're on like an intermittent fasting. It's because when you lose water, you also lose those minerals. But it's because of the fact that we are really more alkaline. We are more acidic. And when we're more acidic, our body tries to, balance out the pH, and it pulls out all those minerals into it. So therefore, we're really, really deficient. For those that are just jumping on, I'm getting a lot of people. Thank you guys. I would love to know where you're from. Please give us heart love. I want to know what you cooked today. What is your temperature at home? It'll give us ideas on what to cook for dinner. But we're talking about magnesium. Because remember, magnesium is such an important mineral. You need it for 300 enzymes, and you need it for protein, like your muscle synthesis. You need it for like cofactors of methylation and detoxification. And then we have ATP and DNA and RNA. It's also needed for all your hormones, like your testosterone, your progesterone, metabolism of calcium, sodium, and potassium. And it's needed for like bones and teeth. And then what happens, magnesium reduces spasticity. It helps to, it improves your chronic pain. It improves digestion, the mood, your sleep, helps you to relax. It actually widens your blood vessels, which is really cool. And then HDL, it actually improves your HDL, your HSCRP, so they say even deficiencies are linked to heart disease. And then Abdullah talked about if somebody's deficient, what are the deficiency symptoms, Abdullah?
Like feeling fatigue, being anxious, experience with chronic pain or cramps. You will have difficult sleeping. You'll feel numbness, and you feel your heart racing or abnormal heart rhythms, and have carbohydrate cravings.
Like your carb cravings.
Like you have a lot of loss of appetite, blood problems and blood sugar,
and that leads to chronic disease.
Yeah.
So then we talked about the different types, right? And then the ones that I would recommend are magnesium glycinate, chelate, and magnesium malate. Magnesium citrate is for anybody that's really constipated, and avoid magnesium if you have poor kidney function, right? And if you avoid the magnesium oxide if you're severely constipated. So then we can get this through food, right? So we talked about where you can get this. So we can get this through food. So Abdullah, what are the magnesium-rich foods? Because I know you're going to tell us which ones we ate today. Ooh. So what are the magnesium-rich foods? Like, if we wanted to increase our magnesium, which are the foods that have that in there?
Well, that's like spinach, pumpkin seeds, yogurt, or kefir. Kefir. Almonds, black beans, avocados, figs, chocolate, dark chocolate, and banana.
So which ones did you eat today?
Today I had some.
So we had
some dark chocolate.
We had some dark chocolate, and then we had almonds because what do we make? What did we make today?
We made
cookies.
Yeah.
We made these paleo sugar cookies. So good. And then we also did in the morning, what did you have for breakfast?
Skillet.
A skillet. And that had your spinach and your chard, and it had your, then we added with some avocados. Like, you can do all of these delicious things. And the morning before that, we had a banana and some nut butter. So we have tons of some almonds. So there we had tons and tons of magnesium today at 1 week. So it's easy just to sort of incorporate these simple foods because they really do make a big difference, right? And again, we're going to quickly just talk about the importance of it, right? Because why is it so important to have magnesium?
It's so important to have magnesium because it helps increase your energy. It calms your nerves. It helps you fall asleep and treat insomnia. Helps with digestion by relieving constipation, relieves muscle aches and spasms, regulates the levels of calcium and potassium. And it's important for your heart health, prevents migraine headaches, and helps prevent osteoporosis.
Yeah, osteoporosis. So that's the benefits of it, right? Because it gives you, remember how we talked about it, that these are important for your nerves. So it helps you calm your nerves. It helps you energy. A lot of people that come to me actually they're such severely fatigued. So therefore, when they're severely fatigued, it's a mess because the fact that they're just not feeling well. And magnesium deficiency is one of those pieces that can be deficient. So start on magnesium, talk to your doctor, see if it's appropriate for you to do that, and you'll benefit tremendously. Another great piece, right? So it helps us with sleep, right, Abdullah? Mm-hmm. So we had sleep and then digestion.
Yeah.
And then for you, again, muscle spasms. It relieves muscle spasms, prevents headaches. So this is for some people who have headaches. Again, magnesium deficiency. Another big thing, asthma, magnesium deficiency. So it really benefits a lot of people just by giving them some magnesium. And I even have people do it for sleep issues, and we talked about insomnia, digestion, muscle spasms, heart, right? It's really important for heart disease because it also balances your blood sugar regulation. So it balances your blood sugar level. It craves a carb. If you're getting a lot of carb cravings, maybe magnesium deficient. And then, yes, love it. Sherry! Hey, Sherry! Mwah, mwah! And my son, you got so much fun. Yes, so magnesium for sleep, so good. There's so many amazing benefits for it. Even osteoporosis. And then the other benefits, remember, let's see what else is we talked about the insulin. We talked about how the eclampsia that I was talking about. So it's really good to take in pregnancy. Also, remember, talk to your doctor because of the fact that it's really, it helps to prevent preeclampsia, which is high blood pressure in pregnancy that can cause seizures that can be detrimental to the baby and to the mom. So again, we're going to quickly just touch up on the best foods again that are high in magnesium. Abdullah, so what are those foods?
Some foods are green leaf, frozen spinach, Swiss chard, avocados, dark chocolate, artichoke, carrots, almonds, cashews, pumpkins, squash seeds, salmon, halibut, and meat.
Yay! good job. So this is why you want to make sure that everything that you put in your body is as nutrient dense as possible. So isn't it easy?
Yes.
So we're getting our nutrition. So this food is like for us. This is so exciting, you guys. Woohoo! Who's here to party with me? Woohoo! Excellent. So now we are here. We touched on magnesium, and we can go on and on about the benefits of magnesium, but it's really an amazing supplement. But it's better to get it from food. But if you can't, for those people who are really deficient in supplement, and I went through that like twice already. So if you have any other questions, we are here for you. I had lots of questions up here, so let's go through some of these. Again, this is question time. This is your time with me and Abdullah. To get our magnesium on, we had, like this morning for breakfast, we had your, because that's a question that I get asked a lot. How do you incorporate these foods into your daily meal that are high in magnesium? This morning we had a skillet. I put all your greens in there, your artichoke hearts. We basically added an egg on top, like some pasture raised eggs with all these delicious things in the skillet, and then topped it with an egg, and then you can have it with an avocado. Like there you got like a magnesium rich meal that's gut healing, that'll balance your insulin levels, and that is the most nutrient dense foods for you. Next. Woohoo! Then we made cookies, right? We made some sugar cookies. Oh my gosh, delicious. Literally just almond flour, a little applesauce, so it was more vegan. There's no eggs or anything in it. So applesauce, almond flour, we had honey, coconut oil. Yeah, so just literally 3-4 ingredients, that's it, with just some salt and some baking soda, very minimal. And then I just made that into a dough. I put it in the fridge for a little bit. Brought that out. We rolled it between 2 parchment papers. And then the kids used the sugar cookie cutouts to make sugar cookies. Delicious. So if you guys have any questions, I'm here for you. Oh, they're watching from the Philippines. How's the weather in the Philippines? How exciting. I want to know all about it. Thank you guys for the heart love. I want to know your questions. What are you dealing with? Me and Abdullah are here for you. And so pretty exciting stuff. So back to what we did today. So we made the skillet this morning. We made cookies. Then for lunch, I did shrimp fajitas. Remember, and then you can even do salmon, or halibut, or different types of meat. All have great magnesium in it. And then I did some vegetables within that. We put some dark chocolate. Some dark chocolate on top of the little paleo cookies, right? We cut those out. We put some dark chocolate on there. Yay! High rich magnesium cookies. Excellent. Then what do we have? So then, that's a lot of food that we had. Ooh, then I even made ice cream. Ooh, with coconut milk and cocoa powder. So delicious, delicious, delicious. And we made some ice cream. We could freeze that. Woohoo! And actually, I stuck some greens in there too. Did you hear me?
Yes.
I put chard and kale and all that into the coconut oil and the cocoa and a little honey. Then you can put the Swiss chard and all of that inside. I froze it, and then you can stick it in little molds and you can freeze it for a delicious fudsicle. But what they don't know is that there's vegetables in it. Did you hear me?
Yeah, but they don't know.
But they don't know. Excellent, you guys. So here, we got lots of comments coming up. Thank you guys for the heart love. Okay, let's start from the beginning. Let's say hi to everybody. Abdullah, you gotta say hi to everybody. Alia, oops. Then we have Salam Ashifa, we have Fatima, we have Marcy, Zainab, Alia, we said, yay. Alia, I would love to help you out too. If you have any questions for me, I'm here for you. Marcy, Do you have any dose on each supplementation? We talked about that, right? So 3 to 4, like 400 magnesium. Can we take magnesium breastfeeding? Yes. Abdullah, nice to see you. What other supplements should we take? Sorry, let me pull this up so I can scroll this. Thank you, Abdullah. What other supplements should we take? What other supplements should one take for inflammation, Abdullah? I'll let you in. What other supplements do you take?
Vitamin D.
Yeah.
Fish oil.
Yeah. Probiotics.
Probiotics.
Right? All of those are really, and then I do like turmeric tea. So I drink my turmeric. We do turmeric tea. So there's so many delicious, bone broth. Ooh, see, he's got it. So can you recommend, Sanya says recommend a brand. So when you look for brands, you want to make sure, because there's a lot of supplementations out there, supplements like magnesium supplements out there that are full of inflammatory ingredients. For example, rice hull, which most of the time is okay for most of the people, but if you're having like gut issues, or I like to get all grains out. So you want to make sure it's clean ingredients. It's just a simple magnesium that you can do. So again, I mean, I use Life Extensions. There's now a brand. There's so many brands out there that are really good and cost effective. So I hope you guys, thank you guys for the heart love. Zainab says, Assalamu alaikum, nice to see you again, Abdullah. And then, Alyssa says, what vitamins do your kids take on a regular basis? I'll let you answer this one.
Probiotics, magnesium, and vitamin D. Oh, and fish oil.
There we go. And we also take like a multivitamin.
Yeah.
So that's something for the younger kids that has your magnesium and everything in it. Abdullah's now a big boy. He started taking some extra magnesium and he feels good. Do you have any fatigue or anything?
No.
So he's doing really good. Oh, Zubia is from Karachi. Hi, Zubia. And then Zainab is from London. Christy. Hi, Christy. If I get a rash from a magnesium oil, do you think I can take it orally without any issues? Now, it depends on what kind of magnesium. I would try to, because sometimes what happens is that in the magnesium oil, there could be some ingredients that could be allergenic to you, like that could bother you. So you want to make sure that the supplement that you're taking is not that it has the exact same things in it, and then just try it. I know I have one patient that I absolutely love, and she loves to like body test, like energy test her supplements to see if that really works for her. There's multiple ways to energy test, check it out. And that way you can tell exactly if that supplement is good for you. It works for some people it does not. But especially if you're in tune, but try it out. There's different types out there, even just doing simple magnesium. Remember, we're getting some of the magnesium also through Epsom salt baths. So if that doesn't bother you, then the other ones should be okay too. But again, there's so many different types. See what works best for you, because everybody is different. And this is why it's so important to talk to your doctor. Fatima says, is eliminating sugar and carbs cause eczema or a rash, and how can it be corrected? So if you have eczema or a rash, is it because, I think the question is, Fatima, is eliminating sugar and carbs a cause of eczema and rash? So I think that means that, no. In order to heal, so remember, we're going to talk about this. So eczema is the underlying root cause of eczema is?
Inflammation.
So we have to lower the amount of all deficits in our environment to lower inflammation that can heal chronic disease. So we talked about gratitude every single solitary morning, keep people around us that love us, making sure we're optimizing our sleep, making sure that we are, like stress managing, either mindfulness or meditation, that whenever we put food in our bodies, that it is the most nutrient dense food for our gut microbiome, that it is for our insulin levels, and it's the most nutrient dense foods for you. So if somebody deals with eczema, what food should we take out?
Grains, dairy, carbs, sugar, all that kind of stuff.
All that kind of stuff is really what you want to take out. And it could be, so if you just take those foods out, then you add in what foods, Abdullah?
You add in like vegetables, proteins, healthy fats. You can add some fruits sometimes, but if you can, don't take it. And
Bone broth.
All that kind of stuff.
Yeah, and then these supplements will definitely help too, because that will help to nourish the body. And then, again, remember, whenever you're detoxing, you need to make sure that you take what baths regularly?
Epsom salt baths.
And can you tell them how to make an Epsom salt bath?
It's simple. Just take about 2 handfuls of Epsom salt.
About half a cup.
Half a cup.
Epsom salt. And you want to fill the tub.
And just fill the tub like a regular bath, and then you just put it in.
Yeah.
That's all.
And then you sit in it, or do you just sit in upside down?
You just sit in it.
So we sit in it and he relaxes. You relax in there?
Yes.
Okay, he loves it. And we try to do that at how many times? Probably a couple times a week?
Yes.
We try to do that. And it really helps your detoxification process. It really helps with all those deliciousness. So I'm hoping deliciousness, detox processes, and relaxation. So I hope that answered your question, Fatima. Yeah, Talibai is from Dallas, Texas. Ooh, that's so nice, because the fact that Dallas is warmer than here. If you guys didn't catch me, in Chicago right now, it's like negative what?
50.
Negative 50. I know. Thank God.
That's just
we are so blessed for a warm house. So remember to do your gratitude regularly, because there's so much to be thankful for. So Sanya says, please recommend a good brand. So there's lots of different brands, Sanya, out there. They even have like prenatal brands. So that would be really good. But any of these magnesiums, always check with your doctor, but they should be okay. Because remember, we have magnesium in our bodies. So, so then we have they love watching our videos. Alia says that my son's name is Abdullah too. He is watching with me now. Say hi, Abdullah.
Hi.
What would be the recommended way to get magnesium into him daily? So remember, these foods are key, right? Starting off with a green shake in the morning with all your vegetables, even have an avocado with your greens, and then maybe do like a skillet for lunch, for breakfast. Then we have like almonds as snacks along with dinner. Then almonds are seeds. Like remember, pumpkin seeds have a lot of has a lot of magnesium in it. Cashews have a lot of magnesium in it. Then we have like
almonds.
Salmon. Yeah, almonds have a lot of magnesium in it. And then we have a delicious
Dark chocolate.
Yeah, that's dessert.
Oh yeah.
We gotta totally do that as dessert. But then we also have like salmon. You can have salmon and tons of green vegetables. That's the best ideal way to get it in. Then there are some supplements that you can do for kids. There's in multivitamins, and there's just supplementations. There's a lot of like Kids Calm and things like that the kids can take that will really help to benefit. So I hope that helps. He's 7 years old. Yes, that will help. So Abdullah is so good. Yeah, Abdullah. You guys, Abdullah has been doing this for a very long time. He's here, so whenever you're sitting here watching with us, I want you guys to bring your families. Bring your children. This is why I want to empower our future generation to make choices that will help heal them from the inside out and help to prevent and heal chronic disease from the inside out. The best, and keep our immune systems healthy. So please always bring your children. Abdullah's here to talk to them. Sometimes the other little kids will drop down if they have issues, but they'll come too. Once levels are good, can you reverse damage to kidneys? So Marcy, if you can explain your question a little bit more there. So once you lower inflammation, so if you have talking about damage to kidneys, so now if that damage to kidneys is due to inflammation, like for example, you have nephrotic syndrome or you have renal failure. I've had a lot of patients with renal failure that once we were able to lower their inflammation, you can fix like damage to the kidneys. Isn't that crazy? So you can fix that depending on, obviously everybody's different, but when you lower the inflammation, the body has a tremendous ability to heal itself. So I hope that answers your question. It's cold around 7:30 in the morning here. Oh, good morning. So So it says my name is Rocco, watching from California. Hi, Rocco. Or Rocio, sorry. Sorry if I totally botched it, but such a pretty name. I'd love to see more recipes of the food. Your food looks delicious. Okay, I have to be completely honest with you guys. I make recipes like my mom did. So I create these recipes with a little bit of this and a little bit of that and a little bit of this. So I make them, right? But now I have to go back, so they never turn out the same thing every time. But I am actually coming out with a course. The course that I have on is through, it's called Real Healing for Real Life course. And that is going to come out, and that has, I have 50 some recipes. I also have recipes in my book called The Holistic RX, Your Guide to Healing Chronic Inflammation and Disease. So there's lots of places here, tons of recipes at the back of the book. Yeah, at the back of the book. And then we also have them on my website. There's an entire, it's called the Healing Bundle that you can easily access. And then you're able to get that then. Okay? I hope that helps. Then we have Assalamu alaikum. What can you take for arthritis and fibromyalgia, anti-inflammatory? So for arthritis, right? Remember, I'm going to help you. How can we lower it? Because arthritis means what?
When you have
inflammation of the joints. So that means all of these diseases are inflammation. So again, whatever we just talked about, putting all of this fire out can help to lower that inflammation that can heal and prevent that chronic symptoms, right?
Yeah.
So, Nick, again, just to recap, you want to, because you have arthritis, fibromyalgia, your body is inflamed. When your body is inflamed, your body is off balance. We need to put it back into balance by first optimizing these: gratitude, stress management up here, sleep, keeping people around you that love you. Then we have is gut healing. Whenever you remember, a lot of these symptoms are due to leaky gut or increased intestinal permeability. So whenever you put food in your body, you want to make sure that it helps to heal the gut. What are the 3 criteria of the food that we eat? Heal the gut, balance insulin levels, and nutrient-dense foods for you. And then we want to make sure that we detoxify the Epsom salt baths and things like that, and making sure every utensil that we use, everything that we use is as clean as possible. So that really helps to help lower the inflammation. Turmeric can be used. Thank you, Abdullah, for answering my questions. Christy says, thank you. Ashifa says, what vitamin can we give an 8-month-old baby? So for 8 months, it can do a lot of the same things. So 8 months should be on vitamin D. So at least 400 international units of vitamin D. Remember that your children, make sure that you get your supplements from the nutrition stores. I have people get them from Costco and from Walgreens or Walmart, and the ingredients that they have on there are actually worse than so here you're putting good food in, good stuff in, but then the artificial flavorings or the preservatives all really cause problems. So we want to make sure that we avoid that. So the vitamins, so we talked about vitamin D. They can take fish oil. There's a little DHA for infants, and then probiotics. So they can do a lot. I should find that will really help to optimize their gut flora. Stage 3 kidney, yes and thank you, yes. So I've had people with Marcy that really need, once you optimize their health, once lower the inflammation, you can help heal that. How many meals should I have daily? So depending on how, for example, what everybody is different. But I try to do 2 main meals a day and then at least have some snack in between. Not me personally, because I like to do a lot of intermittent fasting, but that's what I would recommend. So intermittent fasting to really keep your blood sugars balanced, and then have 1 meal and another meal, but have a gap in the middle. So for me, I like to eat once a day, or even just 2 small meals. And again, trying to remain fasting in between to allow your insulin levels to drop to help optimize lower your inflammation. Asma says, what what would be halal options for vitamins. So there's lots of different halal options for vitamins. Mostly everything that you'll get them, if it doesn't have like pork gelatin or different types of gelatin in it, those are the ones you want to avoid. Even though some people say that it's still, you can still have them because it's medicinal, I try to stay away from all pork gelatin as best as possible. And even if it's like alcohol in it, I try to avoid it. So what I do is, remember, you can find fish oil with even, either you can do liquid, or you can have like bovine, which is like beef, gelatin in it. Like vitamin D is just oil. So the rest of them, all of them are. I haven't really found a really good halal, supplements store. That's why I just go to my Amazon or my nutrition stores that really have good options there. So thank you guys all. I hope that answered your question. Now back to going being a mommy again. And again, we talked about magnesium today. Just to recap, magnesium is really important for your 70 to 80% of the people are deficient. It's important for your nerves, your muscles, your bones, and plays a major role in immunity, because of the fact that every cell of the body needs magnesium to work. And it improves blood pressure, lowers triglycerides, increases HDL, lowers your inflammatory markers like HSCRP, helps with blood sugar. And then deficiencies can even lead to heart disease. The other symptoms of Abdullah, again, what are the other symptoms that cause it?
Other symptoms are the cause is...
So we have your fatigued
and being anxious. You'll experience chronic pain or cramps. You'll have difficulty sleeping. You'll feel numbness. You'll feel your heart racing or abnormal heart rhythms, and have carbohydrate cravings, loss of appetite, and problems in blood sugar regulations.
Yep, and problems with blood, and then leading to chronic illness. So yes, magnesium can help with Lyme because of the fact that it'll optimize your immunity. And so therefore, really making sure that we get enough magnesium through our foods. And we talked about those foods, Abdullah. So the foods that you can optimize magnesium is?
Like sources of magnesium are green leaves, spinach, Swiss chard, avocado, dark chocolate, artichoke, carrots, almonds, cashews, pumpkin, squash seeds, salmon, halibut, and meat.
So there's so many different options. If you can't get enough from your diet, then supplementation is recommended, because especially that 70 to 80% of the population is deficient in magnesium. And the best different types are, we want to take magnesium chelate, magnesium glycinate, or magnesium maleate. Magnesium citrate can be used with somebody with constipation, but if you have constipation, or avoid magnesium oxide. And then always remember that you can get it from these foods. To take it about 2 hours away from a multivitamin. Start with if you're really, really deficient, I would have your doctors do lab tests, and those lab tests can be done like a magnesium serum level. I want it to, if it's 2.1 or less, that means that you're severely deficient. And when you're deficient, you have a lot of these symptoms that Abdullah just talked about. Thank you, Abdullah, for recapping that for us. And those then are your magnesium maleate, glycinate, and chelate. But what's really cool is that if you're deficient, magnesium can be bumped up. Like, so if you're less than 2.1, you want to at least do like 1,000 milligrams for 3 weeks, and then go down to the 500. Thank you, Ali Abaji. Mwah. I love you so much. And then again, if you have any questions, I'm here. Please like and share this video so we can spread the message of hope and healing to those that need it most. Remember, real healing is possible in real life. If I can do it, if he can do it, we can all do it. So again, keep on asking questions. Please like and share this video, and we are here for you. Bye, you guys. Stay warm, and have a great, great week ahead. Mwah. Bye-bye. Say bye.
Bye.